welcome back to Medical Coding with Blue. Today's episode is all about medical coding internships, why you should not work for free. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so first things first, what I'm talking about today is for medical coding internships and those that are seeking to do volunteer work as a medical coder in order to gain experience for their resume. Okay, that's what I'm talking about. So I am not talking about the degree programs, the one for health information technology or health information management. I am not talking about those. Oftentimes the internships or the externships are already included in that program, and so that is part of the curriculum for those, so that is necessary. Okay, I am talking about the medical coding certifications and people who want to do internships and work for free just to get some experience for their resume. That's what I'm talking about today. Okay, so if you are in the degree programs, please don't pay attention to this. Again, I am just talking to those that are taking their medical coding certification exams, the CCS, CCA, CCSP, or the CPC. Okay, so that out of the way, here we go. I get the question occasionally about working internships and where can they find internships as a medical coder, where can they volunteer so that they can get some experience on their resume, because everybody wants experience, Blue, and I just want to learn from someplace and I'll work for free. First of all, you're putting out that energy that you will work for free. It doesn't work that way, guys. You should not ever work for free as a medical coder because you have a trained skill that took money to get. And because it takes money to get this, and it takes a lot of brain power to get these medical coding certifications, you should never work for free. There are alternative ways of getting transferable skill that will help prepare you for a medical coding role if you are not getting a medical coding job right away, or if you've been applying at places and they're just not calling you back. There may be many reasons why they are not calling you back, and I'll have to do another episode about that. But today I just want to talk about people who are actively trying to seek those volunteer opportunities. And sometimes they say, well, I was able to get an internship with a doctor's office. Of course, because that's free labor and you're working for a small practice probably. But there's a lot of politics in working for a small practice. Typically it is the spouse who is doing the billing or is a manager, right? And so a lot of times they don't think that they need a medical coder. But medical coders are very valuable because a good medical coder will know their coding guidelines, and they will understand about the regulations, and they will understand about why we have to code things the way that we code them. So because of that, that's why we will, be very valuable to any practice. But we should be compensated for that knowledge. This knowledge should not be given away for free. Now, if you say, well, Blue, how am I supposed to get experience then? There's other alternative jobs that I've talked about in some of my other videos, like with medical billing. If you can't get in as a medical coder, and then you could start off as a medical biller, because medical billers do not have to be certified medical coders, which I think is unfortunate, because they could benefit from knowing about the medical coding side. But if you start off in a medical biller position, you say, I have, medical coding certification, you are going to understand why these things are denied whenever they have claims that are denied. Whereas a medical biller who doesn't have that medical coding training may not understand why, okay? And so that would put you at the head of the pack, but you have to learn to be able to sell your skill, right? And so you could try that. You could try medical billing. And you don't have to be in medical billing forever. It's just to get you started, and it's just to get you familiar with, working with the electronic health record and getting into the industry and being able to look at notes. And all of these things can transfer over to a medical coding position, right? And so that's the thing that you need to think about. It's not black and white when it comes to getting into medical billing and coding. And is it frustrating that that employers don't want to hire brand new medical coders? Of course it is. But the reason for this is that there are so many fast-paced medical coding programs. and that they're pumping out people who are ill prepared for the real world of medical coding. So they have to, it's like finding a needle in a haystack, essentially, when they meet brand new medical coders. And so if a medical coder has diligently studied in their program, and perhaps they've supplemented their learning as well with the independent study on my channel or other things, workbooks and things like that. If they've done that, and they still apply anyway, and this employer is desperate enough that they will go ahead and give this new person a try, they would probably be surprised, right? If you can pass this test. But you have to be able to put yourself out there. You have to have a really good resume, a really good cover letter, and a good attitude. Okay, medical billing is just one of those transferable places that you can use that time to be able to use your skill as well to be able to get into medical coding. There's also prior authorizations, and prior authorizations has to do with the doctor wants to do a procedure on a patient, and this procedure is going to require a prior authorization. So you call the insurance company, you say the patient has this condition, the provider wants to do this, can they do it? And the insurance company will say yes or no. And if it is a no, then you have to take it back to the doctor and you have to have the documentation reviewed again. So there's a lot of, again, transferable skill there. You're working with the electronic health record. You're able to do, you're able to look at these notes. You're able to, abstract these diagnoses in on what they want to do. So that's something, again, that can be transferred over. So you sometimes have to get creative when it comes to those things. But the other thing that I will say is this. Sometimes you may have a hard time finding volunteer places anyway, because, again, this is HIPAA. All this protected health information is all HIPAA. And, places won't have you running around back there looking at notes and coding things out because, again, you need to be an employee to be able to do that. Okay, so that's something that you have to think about. And again, guys, it's just not worth it just to say, well, I spent 80 hours here and I coded these charts, when you can be doing other things. Okay, and then another one would be charge entry. Now, charge entry is not medical coding, but again, it is giving you some transferable skill because you're entering in the codes and you're verifying that those are the correct codes that goes into the system before you submit them in, that kind of thing. So those are the types of things that they do. And again, that's more transferable skill. And when you're looking at ways of how can I get in somehow, some way, and you want to get that experience, apply at a temp agency. The temporary agencies, and if you Google in your area, please don't ask me, guys, because every place is different everywhere, and I don't know all the companies in the US, okay? So if you Google in your area, temporary agencies for medical professionals, just like that, temporary agencies for medical professionals, you will see all of the temporary agencies in your area that will be catering to the medical field, okay? And you'll see positions probably for billers. I know that you'll see some for medical coders. That was how I got my first job, which led to my second job, which led ultimately to my forever home in medical coding. So it is possible to get employment with them. And when you think about the temp agencies for medical coders, don't think about it as day labor, right? Where you're only working for one day and then that's it. It's not like that. They typically have like short-term contracts, or it's just going to be for a few months or, whatever, what have you. I was at my first assignment for 3 months, and then my second assignment, I was there for 8 months. And then I finally, again, landed in my forever home. But I applied for that position on my own. And so, that's just something that you can still actively be doing that when you're working for a temp agency. A temp agency is meant to find people who are qualified. And even though you don't have experience, they don't need you to have experience. You're certified. That means you are trained. That means that you are qualified to work at that place because they're looking for a certified medical coder. Unless they have some specific requirement about time, which they typically don't if they're going to a temp agency, then you should be able to get in. And the thing about working at the temp agency is sometimes these employers will go through the temp agency to hire somebody on a temporary basis to see how they work out, because they don't want to have to go through the whole process of hiring somebody and then that person quits, or it doesn't work out, or it's not a good fit, so they go to the temp agency to just sort of try before you buy, and that kind of thing. So because of that, you're able to get in, you're still able to gain experience. That is experience that you can put down on your resume. And then of course you're making those connections as well, because they may be looking at you to see, okay, is this person going to be somebody that we can hire on permanently? All right. So that's why you always want to do your best. And a lot of people don't think about the temp agency because they want to get that immediate job position right away, that high salary right away. They don't want to work up to it. They don't have the patience for it. But this is the real world, guys. This is how the real world works. Does it stink? Is it really difficult? Of course. But it's not without its purpose. If it was so easy, then everybody could do it, right? And so that's the thing that you have to think about. The things that we do are so important. It is critical that we are well trained. It is critical that we continue our own education on our own, not just in the medical coding realm, but also in the our professional presence and our professional building, and sort of and there are communication skills. Those things are really, really key to being a successful medical coder. So it's not a reason to give up, and it's not a reason to get discouraged when you see these jobs asking for 3 to 5 years experience. They are always going to ask for 3 to 5 years of experience because they don't want to train. They don't want to have to train somebody new. And again, you can, this new generation of medical coders can really change the way that the industry looks at them by preparing themselves. But until people start doing that, and until people stop with the whole "I want somebody to train me" deal when they go into the workplace, until they stop that, and until they start seeing how important it is to learn this stuff on your own, and to learn to do your research and ask questions when it is appropriate, but not that you want to be hand-fed every single thing, right? You have to learn to have a lot of independence as well when you're getting into this. And until people start doing that and start showing the employers, hey, I'm here for business too, and I'm here because I really want to be a medical coder, and I'm doing the best that I can to learn everything that I can, because we have to know what doctors know while never having gone to medical school. Not saying that to scare anybody, but I am saying it to prepare you, because it is true. We have to be able to read and understand and comprehend doctors' documentation. Doctors who have been through years of medical school and who had years to learn all of this stuff. I always tell myself I feel like I have to hurry up and catch up, because there's a lot of things that I know I still need to learn, right? When it comes to not just medical coding, but pathophysiology and even anatomy. I'm still learning about anatomy. There's so much to learn when it comes to that. But don't lose the faith, guys. Don't lose your faith when it comes to your skill. And don't give your skill away for free. That is the biggest message that I have today. And when I see people do that, when I see people say, oh, well, I'm volunteering and I'm doing this, and if they like me, they say they may hire me. I wouldn't want to work under that kind of uncertainty. Like, if we like you, we'll hire you on. And I know in some industries it's like that, where you have to kind of pay your dues first before, and then you work internships and things like that. But until people stop doing that, it's always going to continue. There's always going to be some sort of apprentice program out there where they're not going to pay, or they're going to pay very little. And I don't think that that's right. I think that it's fair to pay the person for their knowledge, and pay the person for their knowledge when it comes to, like, okay, we're just starting out. Obviously, you're not going to start out on the high end of the pay scale. That would be foolish of businesses to do that, right? Because then they would lose a lot of money for people, and not paying, them by their knowledge base. Now, if your knowledge base is just entry, right, and you're just starting out, you're going to work your way up, and that's what we all have to do. We all have to work our way up. I did not start off at the high end of the scale, but I started off at a fair wage. And I was happy with that wage. And then my wage went way up when I went to the second place. And then it went way up again. And so it was nice to get those jumps in pay. Because, obviously I had earned it. And I had started off fair and where I didn't know anything. And working at the Cancer Therapy Research Center, that was a lot. It was a fast education. Seeing as how that was my very first job in medical coding. But I was able to take all those skills that I had learned and I was able to transfer them over to my next position, right? Working with evaluation and management and working with procedures and working with diagnosis codes, all of that came into play when I started my next position. So everything can piggyback off the other one. Okay, it's something that you have to understand about this industry. Okay, but it's not a reason to be taken advantage of, and it is certainly not a reason to pay. I have heard of that, and it makes me sick to my stomach because I think that is just so cruel to do that to people. I've heard of people who pay for their internship, and I don't think in medical coding, and I don't think that that's right. And they say, oh, well, when you get done, that you can, we'll write you a letter that you did all this time and you did all these things. That's not right. It's not right because somebody's benefiting somewhere, and it's unfair to make medical coders pay to learn on the job stuff, right? If you are working someplace, they need to pay you. All right, unless you are in a school, then that's something different. But you should never, ever pay for a medical coding internship. Okay, so if you're going to ask me that in an email, I will tell you don't ever pay for a medical coding internship. It doesn't matter because no matter where you are in the U.S., there's always places that are hiring. All right, and while maybe you live in a rural area, there's always going to be opportunity, but you have to really look and do your research. Because people who live in rural areas do medical coding all the time, all right? So that's just something else that you ought to know. But with that said, I want you guys to think about where you're working, and even the place that you start, it's probably not going to be the place that you end up forever, okay? So don't think that way. If you start off in a place and it's paying decently, but you want to move on really quickly, you can continue to apply for other jobs. You don't have to stay there for a long time, all right? I say this all the time to people who start off in risk adjustment. Get your experience and move on quickly. Because in positions like risk adjustment, where you're just diagnosis coding, sometimes employers will not count that as experience. I've seen it on the job listings. I do my research on the job listings, guys. I do. And that's what I see when I'm looking at these job listings. And they say if your only experience has been like in PT and OT, because it's very limited as well on the procedures that they use, or risk adjustment, they do not count that as experience. There are some places that are like that. And I look everywhere. I look not just in Texas, but I look in New York and Florida and California. And that's a common theme that I do see. So I do suggest that you all look at the job listings and pay close attention, all right, to the things that are out there. If you start in a place and you know this is just your starter place, it's okay. Learn what you can from them. And if you want to move on, then move on, all right? As easily as you could get that job, you will be able to get another job, all right? Don't lose faith in that. And don't set your heart on one place right away. All right, because there may be other opportunities out there for you. You just have to be willing to get out there and run into things that you don't understand and things that are difficult. And if you tell people, oh, I want entry level, there's going to be a ton of people that are looking for entry level. All right, you don't want to get sucked into that either. Medical coders should apply for places that are asking for 3 to 5 years experience, as long as the position is for medical coding and not something more advanced like CDI or something like that. But if they're asking for medical coders, then by all means, Your credential says that you are competent. If you know that you got your credential and for my fast-paced medical coding program, and that you know you were rushing and you don't understand a lot of things, it is your responsibility, my friends, to make sure that you get those workbooks that I've recommended at least, and work through those, or work back through the material that you do have from this school. Now that you have the time to slow down and really look at what you're doing, because it's important. Once you start getting out there and you start getting tested for those assessment tests, that's going to be your make or break too. If they give you a chance and they know you don't have experience and you do really well, you know, that's that can lead you to the next step. But if you do terrible because you didn't practice and you stopped practicing altogether for coding, it's going to show, and you're just going to confirm what they've already suspected, that you are not ready, that you don't have the knowledge or the capability to learn what they have going there at that facility. So again, you're invested in this now, and this is something that you need to, you know, embrace. Just embrace it, guys, because you will get a job as long as you remain positive. You apply for places even though they're asking for experience. You don't just pigeonhole yourself into entry-level positions. You don't pay for internships. You don't work for free. As long as you do that, and again, you have a really good resume and a really good cover letter. Resume needs to be 1 page, max 2 pages. Don't go past 10 or 15 years in your job history, all right? Everything that you've ever done, trust me, there is some transferable skill there, all right? Whether it is that you were having to keep things organized, or that you were having to work with Excel, or that you had to protect private information, there's always going to be a transferable skill. But it is on you to look for those things that are unique to the position that you had before that you can bring to this position, all right? This current position as a medical coder. I've seen teachers who have transitioned into medical coding, and they said, well, Blue, I don't have any skills that are going to transfer over. I said, you're a teacher. Number one, that's going to make you a very good provider instructor. They were like, really? And I'm like, yeah, because think about it. You know how to instruct. You know how to teach, right? I said, it's just a matter of doing this for adults now. And you had to protect private information of students, didn't you? Because you didn't just go around willy-nilly sharing your student information, did you? No. Well, there you go. Again, transferable skill. And there's a myriad of other things that I could go to when it comes to that. But you would be surprised all the things that you do have and all of the skills that you can bring over into being a medical coder. But like I said, take a look at my resume tip videos if you're interested in that. I also do resume rewrites. My rate and contact is in the description box below, so make sure that you check it out, guys. Okay, it is possible. We all started somewhere. We all did it. You can do it too. All right, I'm gonna wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.